Thank you for allowing us to be here today and speak to you about something that's very close to our hearts. My name is Bob Malizzo. This is my wife, Barbara.
Hello.
We're from Indiana. And we were victims of a hospital error. I want to start out by telling you something about my daughter, who obviously passed away due to this hospital error. My daughter was a very beautiful, a very articulate, and a very intelligent person. She was very kind, and she was very caring and very giving. And when I say she was giving, she was an organ donor. And in her passing, one of my closest friends is alive today because of a kidney that he received from my daughter. I will tell you, my daughter's name is Michelle. She was our oldest child. She had 2 children, ages 1 and 7. She was a graduate of Purdue University. She had a degree in elementary education. But she was in management, and she was in business with me. What happened to her started in 2007. We found that my daughter had a polycystic liver, and it was creating a lot of problems for her. So a surgeon recommended that we go to Northwestern and see a specialist at Northwestern, who did a liver section on her in 2007. She recovered from that and was doing quite well until about 2008. And she had some complications with her liver again. So we went back to Northwestern to see this surgeon who had moved on to another hospital. And they recommended that we go to UIC and see a surgeon there, which we did. And it was found that a bile duct in her liver was blocked. And she was going to need surgery. But they couldn't do the surgery right away because the surgeon that specialized in livers was out of the country and wouldn't be back for a month. So they decided to do bypass surgery on my daughter so she could get rid of the waste from her liver. They did the first surgery, which went pretty well, but she woke up in the middle of the procedure. And they sedated her some more, and we got through the first surgery. About 2 weeks later, there was a reoccurrence of the problem that she had, and they found that the bypass tube was blocked, and since the doctor who was out of the country wasn't back yet, they thought they would just change the bypass tube, and she'd be fine for the couple weeks that was needed for him to come back into this country. So we scheduled the surgery. She went in actually on her daughter's first birthday. They were going to operate her, and they operated on her the following day. Prior to the operation, we were waiting in an area by the room where they were going to do the procedure. And an intern came up to her because my daughter had expressed concerns about waking up in the middle of the procedure. And when we originally discussed it, we thought it would be best for her to have an anesthesiologist there. Well, the day of the surgery was delayed for a few hours. We're in this waiting area, and an intern came up to her and said, you know, do you want to wait for an anesthesiologist? It's going to be another couple hours. And she says, well, I don't know. I woke up the last time. And he said to her, don't worry, we'll sedate you. You won't wake up. And he was correct. She didn't wake up. My wife and I and my son-in-law were in a waiting area when the surgeon came out and asked us to come into another room. And as we entered the room, he said, everything went terribly wrong. Your daughter had a heart attack. I said, what do you mean a heart attack? She's 39 years old. She never had a heart problem. What are you telling us? Well, we're working on her to bring her back. Bring her back? What are you talking about? He said, I have to go, and he went back into the room. Maybe 15 minutes later, we saw them wheeling my daughter out, and they said they were bringing her up to ICU. So we all went up to ICU in hopes that our daughter would recover. After a few days, my daughter was on a ventilator. There was really basically no response from her. Dr. McDonald and a Dr. Schwartz, Dr. McDonald's associate, Nikki, and a Dr. Mayer, asked if they could have a conference with us. And we said, sure. And they said, we think that we may have committed some errors in your daughter's procedure. So what are you talking about? You committed some errors. Dr. McDonald says, I don't know all the facts yet, but I'm investigating, and I will be back in a couple days to inform you what transpired. Well, obviously, we were very reluctant that we were going to get the truth. We thought they were going to come back with a story that it was just my daughter having a heart attack, and it was unfortunate. But my daughter was still on a ventilator, so we didn't know if she was going to recover or not recover, but as the days passed, we were quite concerned that she wasn't going to recover. About 2 days later, Dr. McDonald and the staff met with us again. And he said, it was our fault. Your daughter's in here because of us. We made a lot of mistakes. And hopefully your daughter will recover, but the likelihood is that she won't. And we apologize for what we did. Obviously, we were angry. How could this happen? We brought her here to the sacred hospital that we thought was the best in the area to take care of our child. And you let us down. Dr. McDonald said, I know we did, and it's my fault. Well, it wasn't Dr. McDonald's fault. We all know that. There was a number of errors that were committed on my daughter, including the emergency response team who came in and trusted a monitor, and no one used their stethoscope to see if her heart was beating. If they did and performed CPR, she'd probably be alive today. But they didn't. So we spoke with Dr. McDonald more, and we said, look, we don't want this to go in vain. What happened to my daughter, or our daughter, excuse me, should not happen to anyone. And what could we do to help prevent this from happening ever again? So Dr. McDonald said, I will let you know, but I do have some ideas, and I could assure you we're going to change our procedures, which they did. About a year later, he approached us. He gave us time to absorb what had happened, but he kept in touch with us, and one day he wanted to sit down with us and ask us a very important question. And I'll let my wife take it from here.
Well, when Dr. McDonald met with us about a year later, he asked if we would like to have a seat on the safety board committee, and it would be a lifetime seat. It would go from us to our other daughter, Christina, even down to our grandchildren and Michelle's children. We felt honored, and we felt like maybe we could help make a change. And when we do have the meetings, we walk out of there and we really feel good, because it's really out in the open. They tell you any mistakes that were made, near misses, and then what are they going to do about it. And then when we meet the next month, they usually have a solution. Things have already been put in place, and every time we do that, we think of Michelle and thinking, well, this wouldn't be done if it wasn't for her. I'm really glad that Dr. McDonald gave us that year, because I know we would not have been ready to participate in anything. It was a very tough year. But I do want to say the honesty of the hospital really helped us. I have friends, when I tell what happened and the hospital admitted it right from the beginning, they can't believe it. They've never heard of such a thing. And then for the hospital to stay in contact with us and have us on committees and do everything that we do to help, they just think it's amazing. But really, that's the way it should be. If a mistake is made, it's so much easier on the family if they just admit it and say, what can we do? And your loss is there, but you still feel like maybe you can do something to make a change. So it's been very important to us.
In closing, a couple things I'd like to say. One is that a layperson shouldn't be charged with making a medical decision, like when the intern approached my daughter about an anesthesiologist. The surgeon or his staff should recognize there's a concern and do what's best for the patient. And I think that's a very important issue, is communicating with the patients. And lastly, because of being on the board and seeing near and misses and what they do at UIC to prevent any such happenings at their hospital, the sincerity of the committee, which is about 40 people, made up of doctors and nurses and managers, I've become a patient at UIC. I have a bad heart. But because of their honesty and what they did for us to help us through a very difficult time, like attending the funeral, Dr. McDonald and his staff, has created an atmosphere of trust. And I recommend this hospital to my friends or anyone that is concerned about their illness. Thank you for allowing us to speak. I will turn this over to Dr. McDonald.